Yes, ma'am. Apo. Ay! Yes, ma'am. Ay. Pupunta na po. Apo.
ADHD stands for Attention Deficit Hyperactivity Disorder. Now, ADHD is a psychiatric condition characterized by poor attention span, excessive physical energy, and impulsive behaviors. Now, the condition starts in childhood, and in 70% of these children, the ADHD persists up to adulthood. Genes may play an important part in ADHD, and some research would even say that exposure to cigarettes, alcohol, or other toxins while in the womb may also play a role. And some experts believe that ADHD may be caused by an imbalance in the neurotransmitters of the brain, particularly dopamine and adrenaline.
G, yes? Nasend mo na ba yung file na sinasabi ko na i-send mo kay boss? Ano yun? Yung file na sinasabi ko na kailangan na mamayang gabi ni boss? Ngayon na pala yun! Wait lang!
Saan na ba yun? Wait lang. Dami kasi dito eh.
Nung una, pwede naman yung mas importante yung unang gawin.
Ito na nga, ginagawa na nga eh. Diba?
Hindi naman ikaw yung pagagalitan ng boss mamaya yun kapag nagkaano.
Yan.
Basta sabihan mo na lang ako kapag pag nasend mo na.
Okay na.
Kala mo kung sino magaling, sip-sip naman. Kagawa na nga ito. Bilis naman.
The symptoms of ADHD are the same in both children and adults. The symptoms belong to three categories, namely inattention, hyperactivity, and impulsivity. So let's discuss inattention first. Now, these are the symptoms of inattention. So, a person with ADHD would often fail to give close attention to details. He would often make careless mistakes in work and other activities. He would often have difficulty sustaining attention in tasks or play activities. He would often not seem to listen when spoken to directly. He would often fail to finish chores or duties in the workplace or in school. He would often have difficulty organizing tasks and activities. He would often avoid or dislike tasks that require sustained mental effort. He would often lose things. He would often easily get distracted, and he would most probably be forgetful. So these are the signs of inattention.
Girl, napasa ko na. Okay na. Nahanap ko na siya. Tingnan mo na lang sa email mo.
Uy, salamat pasensya ka na natarayan kita. Alam mo naman si boss, lagi tayo pinipressure.
Okay lang yun, girl. Ano ka ba? Sige, later. Bye.
Girl,
Ha?
parang hindi pantay yung kilay mo.
Ay, talaga? Pero ako na mirror.
Sige, nabi mo na lang.
Ay, oo nga, girl. Hindi nga pantay. Ay, ang ganda ng shade ng lipstick mo, ah. Patay. Thank you. Sige. Ito na ako, mamaya tayo kakain, ha? Patay.
Uy, yung kilay mo!
Ay,
hindi
yung
pantay,
kilay.
di ba?
Oo nga. Siyempre, alam mo na pag magaganda, nakakalimutin. Ay, eto pala. Grabe yung gamit mo. Gulo, ah.
Ay,
Ayan.
pantay na.
Sige, thank you. Later, sabay tayo mag-lunch. Bye-bye.
So now let's go to the second category of symptoms, which which relates to hyperactivity. And the person with ADHD would actually often fidget with hands or feet or squirm in their seat. They would often leave their seat in situations in which remaining seated is expected.
Ay, sorry! Sorry, akala ko kasi. Anong oras yun? Yung crush mo. Ay, yung crush mo. Ano eh, yung pinikilig ako kasi sabi niya sa akin, sabi niya, gusto niya.
The person with ADHD would experience subjective feelings of restlessness and would often have difficulty playing or engaging in leisure activities quietly. It's as if the person is often on the go or often acts as if driven by a motor. These are the signs of
Girl, napasa ko na. Nahanap ko na. Okay na. Okay na tayo? Bati na tayo?
So now let's talk about the category of impulsivity. The ADHD patient would often talk excessively, or sometimes he would blurt out answers before questions have even been completed. Sometimes there would be difficulty awaiting for his or her turn, and he would interrupt or intrude on others. They can sometimes be very hyper-focused. The above symptoms we discussed should have been apparent at 7 years old or younger. So it would be evident in the grade school. And the symptoms should also have caused significant problems at school or at work and in relationships. So it would be quite obvious that even as a child, there is a problem. Now, adults with ADHD usually have problems due to their poor time management, poor anger management, lack of social skills, lack of organizational skills. They can have impulsive decisions and irresponsible behaviors. And also, adults with ADHD are at risk for addiction, whether it be a drug addiction, gambling addiction, sex addiction, or even computer addiction. However, some adults with ADHD may adapt to their symptoms over time. In fact, some adults with ADHD actually enjoy the increased energy which they feel. It's like some sort of high or extra energy for them. So what is the treatment for adult ADHD? Antidepressants, which target the brain chemicals serotonin and norepinephrine, are the most effective. These antidepressants include the tricyclics, medications like venlafaxine, maclobimide, and bupropion. Besides antidepressants, we can also give non-stimulant medications which offer the same benefits as stimulants, but they act in a different way on the brain. One non-stimulant medication is atomoxetine or Strattera, which is particularly effective for those with poor attention span. And lastly, we can also give psychostimulants, which are a mainstay of therapy. But due to the addictive nature of stimulants, many doctors recommend the trial of non-stimulants first. Methylphenidate like Ritalin or Concerta are often the first-line therapy. Other stimulants are the amphetamines such as Adderall. Now, what are the various therapies which can help an adult with ADHD? Life coaching is to help them stick to their goals and strategies at work and at home. They can also undergo individual psychotherapy to deal with their personal issues. They might also be helped by family therapy, so the family members can understand what ADHD is, and they can also learn how to offer better support for their loved one with ADHD. And then we can teach ADHD patients relaxation techniques to reduce their anxiety and stress. And lastly, we can give them natural supplements such as omega-3 fish oil, evening rose prim oil, ginkgo biloba, inositol, and phosphatidylserine. Perhaps I could give you around 5 tips if you're an adult with ADHD. So first of all, it's good to take your medications as directed. So number 2, it's good if you find ways to lessen the distractions. So you have to find your own personal way or strategy. Thirdly, you can be more organized by making notes, by using a daily planner, and setting your alarm clock. Probably you could control your anger and impulsive behaviors, again with your own personal strategies. And lastly, you can burn off excess energy by getting a hobby or a sport. So these are some tips. Of course, there are more, but these are things that we can discuss in your own personal sessions.